Thank you, Mr. Speaker. I ask unanimous consent to revise and extend my remarks.
Without objection, so ordered.
Mr. Speaker, I've come here to the floor tonight with my colleague, Representative Duffy, to talk about the crisis facing Medicare and to talk about the Independent Payment Advisory Board. Some call it the IPAB. It's a part of the President's health care law, and this House is going to address it this week. But I want to start out by talking a little bit about the crisis that we're facing in this country over Medicare and what it means to our seniors. My mother is 71, and she's a Medicare recipient. She counts on Medicare. She paid into it and is now using it to take care of herself. And we've got to make sure that future generations are able to rely on, count on Medicare. So I want to start out this first chart here, Mr. Speaker. It shows what a significant portion of the federal budget Medicare consumes. We have it here at $555 billion, and that is per year. This is a yearly budget for the federal government. It is widely agreed upon by Democrats and Republicans that Medicare is going bankrupt. Some estimate it 7 years, 8 years, 10 years, but most everyone agrees, having looked at the numbers, that Medicare is going bankrupt. Now, I've got a quote here from Senator Lieberman, who addresses a criticism that we hear a lot about the Republican reform plan on Medicare. If we can agree that Medicare is going bankrupt, we then have to ask ourselves, what are we going to do about it? What are we doing about it? Well, the House has acted to reform Medicare. We acted last year in 2011 as part of our budget to reform Medicare to save it. The only reason we propose reforms to Medicare is because we want to save it. We want it to be there for the next generation. I've heard a lot of criticism of, you want to change Medicare as we know it. I say no. Medicare as we know it goes bankrupt on its own. We have to act to save Medicare, Mr. Speaker. And in this quote from Senator Lieberman, he says, quote, "The truth is that we cannot save Medicare as we know it. We can save Medicare only if we change it." Now, like House Republicans, I think it's fair to say, Senator Lieberman is talking about what we must do for the next generation. Like our proposal, I think a lot of us agree that we can make changes to Medicare for the next generation, and for those, for example, 55 and 0, leave it as it is. Why? Because people have counted on a particular way the program works, and we don't have to change that to start saving. We can just change it for the next generation. I have another quote here I want to share with you that shows that President Obama, at least in his words, understands that we have a problem with Medicare. Quote, "If you look at the numbers, Medicare in particular will run out of money, and we will not be able to sustain that program no matter how much taxes go up." This is the President. He continues, it's not an option for us to just sit by and do nothing. Unfortunately, those are just words, because that is precisely what the President has done. Sit by and do nothing. It's what the Senate has done. The House has acted to reform to save Medicare. Now, the President's health care law has a provision in it, the IPAB that I referred to earlier, that impacts Medicare, but it doesn't save Medicare. It rations Medicare. How does that work? Well, this is an unelected board. It's an unelected board that will make decisions on where Medicare is cut. So the President has had an opportunity to propose reforms to the way Medicare works so that we can innovate and change it to save it for future generations, reform it, upgrade it, do things better. But instead, the President's approach is simply to cut the levels of spending but leave the overall functioning of Medicare the same. So, no innovation, no new approach, no reform, just cut when we run out of money. Well, what does that result in? It results in seniors not getting the care they need, and not just because services are reduced, but because a lot of doctors won't take Medicare patients. This is already a problem today. Today, there are seniors looking for a doctor to help them with their particular problem, and doctor after doctor says, "I'm sorry, we don't take Medicare." That problem is only going to get worse if the IPAB, the Independent Payment Advisory Board, that's in the President's health care law, if it does what it is scheduled to do. Now, what are we doing about it here in the House? Well, we certainly voted to repeal the President's health care law. That passed the House, did not pass the Senate, but we've tried a lot of other ways to get at the problem, and one that we're going to do this week is to repeal the IPAB, repeal the Independent Payment Advisory Board. And I've invited my friend, the gentleman from Wisconsin, here tonight, who wanted to join me on the floor to talk about this. And I yield to the gentleman from Wisconsin.
I appreciate the gentleman from Arkansas.